everyone. Thank you very much for tuning in again into the by now 8th edition of Liberties in Lockdown of the European Liberal Forum. Thank you very much for inviting us again to your offices, your living rooms, or wherever you are watching this in these interesting times that we are still under. Today's Liberties in Lockdown will be focusing on minding the generational gap. As we all know, COVID-19 has had quite some significant effects on how we lead our daily lives. But as most of us are also aware, this is disproportionately affecting people in societies, especially for those in vulnerable groups. Even if the lockdown is lifted, life will not be the same as before. For all of us who have loved ones that are, for instance, in care homes or hospitals, life has also been quite different. From my own experience, I can also say that not being able to contact physically grandparents, parents, has an effect on us, of course, but it has a more devastating effect on those who are actually in those care institutions. This is something we're going to talk about today, how this crisis is affecting those risk groups. And we are taking the elderly in societies as one of the examples. Of course, we could also talk and touch upon disabled people, other vulnerable groups in societies, but let's talk about the elderly today as one of the examples, as one of the most effective examples, one of the examples that is at biggest risk of social exclusion and isolation. I would like to start with two things before I hand over to the moderator. Number one, this event is recorded and being live streamed on Facebook. So please be aware of that. And the second thing is that you can ask questions to our moderator and to our speakers of today by using the little Q&A box below. And now, without any further ado, I would like to thank you again on behalf of the European Liberal Forum, the political foundation and think tank of the ALDE party here in Brussels, and the liberal forging mill of liberal ideas here in Brussels. Thank you very much, Ronan, who is the Policy and Development Coordinator of the European Social Network, for taking over the moderation today. Thank you all the speakers, and thank you all at home. Ronan, you have the floor.
Thank you very much, Daniel, and may I also say good morning and welcome everyone to this, as Daniel said, the 8th online event of the ELF, a new series on liberties and lockdowns. Quite rightly so, my name is Ronan Mangan, Policy and Development Coordinator with the European Social Network, an independent organisation which represents the perspective of national, regional and local social service authorities in Europe. Maybe before to start, giving context and a frame to our discussion today, it'd be good just to make some housekeeping announcements. Like Daniel rightly said, this webinar will be recorded and streamed live on Facebook, so please bear that in mind. Also, all microphones and cameras have been turned off. However, please do use the question and answer button at the end of your screens to pose your questions to the moderator or indeed to any of the speakers we will have with us today. Finally, as well, tomorrow afternoon, hopefully the recording of this session will be available on the ELF's website. So for those of you who wish to listen again, voila, this will be possible by, like I said, going to ELF's website tomorrow afternoon. Now, also just to say regarding the structure of today's session. So today's session will be largely broken up into two parts. The first part will focus on the interventions of a number of key speakers we have the pleasure of joining us today and who are in their own rights experts on this topic. Following this intervention, we will then have an open discussion or open debate where, again, like I said before, we would invite your questions for the speakers on this a very important topic. Maybe now just to frame our discussion somewhat. The coronavirus pandemic has exposed, unfortunately, a number of risks between the various groups in our societies. The existing divides between the old and the young appears to have deepened even further, as the virus has shown how different age gaps are affected in different ways, not only in terms of mortality, but also, of course, in terms of the impact on daily life. As Daniel mentioned, sadly, the statistics in terms of the impact of COVID-19 has disproportionately affected older people. Some have gone so far as to argue that risk groups should isolate until a vaccine is developed, or at least until the crisis has weakened somewhat. From a fundamental rights perspective, however, this action would discriminate against the elderly, people with underlying health conditions, and of course, those who are disabled, and would only serve to further divide society into two groups: those who are permitted to be or to move about freely, and those who are not. The support demonstrated by so many communities for people who are older and more vulnerable has underlined the solidarity that still exists between the generations. But this support can only be extended so far. So in today's discussion, we'll start to examine how can we ensure that these groups don't become relegated to second-class citizen status. Likewise, how can governments provide a just and equitable treatment of these groups? And of course, what can the rest of us do to help those who are most vulnerable in this crisis? So to discuss these topics, I'm very, very happy to introduce our first speaker, MEP Dragos Pislaru from Renewed Europe. MEP, the floor is yours.
Hello and good morning. I hope that the usual question goes well, that you can hear and see me well. That's actually how we start the sessions these days. Indeed, a very important topic, and thank you very much for allowing me to kickstart this discussion. From the Parliament, we have here a special day when we are going to discuss with the Commission about the recovery plan for Europe. And it's kind of well fitted to have our debate right now, because from time to time we are actually neglecting the vulnerable categories when we are talking about recovery, and I don't see possible a recovery without actually thinking of all the vulnerable categories. Now, the introduction that you provided, Ronan, is actually quite comprehensive. Indeed, I will try to touch on three particular issues. One is the rights issue, the second is the economy issue, and the third one would be the care and solidarity issue. Let me start with the first one. Indeed, what is actually happening nowadays is that we have seen that the vulnerabilities of our society have never been more exposed. We've seen that the crisis was actually more or less highlighting these vulnerabilities that we are actually having in society. We made surrealist efforts to keep a distance from our parents and grandparents in order to protect them from the pandemic, but yet sadly we've seen that the numbers of people over 65 affected by the coronavirus were actually quite high. And it's quite important that to acknowledge that the civil society was way ahead of us, the politicians, the decision makers, and we had numerous grassroots initiatives to support vulnerable citizens, to help all people with the groceries and with any other things. And so we've seen actually solidarity, de facto solidarity, as Schuman has actually mentioned 70 years ago, happening, and that's actually very good news. On the other hand, again, at the decision maker level, there were these kind of decisions related to the lockdown, and even some scenarios that were quite scary, in the sense that the elderly should be locked down even further, that we should actually protect the elderly by closing them out, shutting them off, and that's not the right approach. And we've actually put forward in Renew that you need actually to have targeted measures and specific information for vulnerable groups to provide the right conditions and protection. But you cannot just decide in the name of such an important group of our society how you are going to treat their rights without proper consultation and without seeing if there are alternative scenarios. And I'm glad to see that in most member states we did have a more reasonable approach for this point of view. Now, when we are talking about rights, we are also talking about equal access and opportunities, and that's actually quite important. We've seen that, for instance, in some countries such as Sweden, they've more or less experimented on elderly people as well, especially in the institutionalized facilities that the protection was not available. And it was more or less like the survival of the fittest, and that's not the right approach, indeed. It is about individual responsibility, but you cannot just neglect that you have vulnerable groups that you need actually to take care of them. Now, what is actually quite important to shift from this particular topic to the access and opportunity topic, that's quite important to understand that for the elderly, the care system is actually very poor and dangerous in the institutionalized settings, but also even with independent caregiver services. And I will say that if we are talking about seniors with disabilities, the situation is even worse. So what we are actually advocating from a Renew Europe standpoint here in the Parliament is that we should actually invest, and that's actually quite important, invest in equal access to treatment and healthcare. And this is something that is structural. This is not only related to the post-crisis or linked to the crisis. So we believe that this investment in healthcare and investment means also by aligning with the private sector and providing a partnership between the public and private sector for that is quite important. Also, in terms of economy, we believe that developing and transitioning towards a silver economy is actually possible with adequate investment in public finance. And we also, I would like to underline the fact that we need the ICT tools for the elderly. We have a gap there that is contributing for, at this distancing that we are having. We need to equip the elderly with the skills, the digital skills that they need, so that they will have more capacity to interact, to socialize in these particular situations. Also, the whole discussion about the care industry and the major opportunity that we have in Europe for that, it's very important. And I'm glad that even today we are going to hear from the President of the Commission the fact that Europe will focus on a health program. And I'm looking forward to see that we are going to see investment in a care and healthcare industry throughout Europe. And that's actually quite important and good news. Now, the third part, so we've been talking about rights, about the economy and the investment needed and the private sector contribution. The last part would be about solidarity and the caregivers themselves. In 2016, as a Minister of Labor, I was actually proposing a project which was called Community Grandparents. And it was about involving the elderly into society, not keeping them apart. I mean, what is happening in many of our countries in Europe is that the elderly are basically abandoned by the society, and they are not given the right opportunity and access to actually keep themselves engaged and participating in for the benefit of the society. And the program that I was actually suggesting was helping the elderly stay active in the community with the opportunity to care for other seniors, to try to provide home care, try to help the children in schools and so on and so forth. And I've seen that happening in many other member states through civil society programs as well. So what we need to do is to pay particular attention to keep the elderly engaged in the society, and that's actually quite crucial. And I would say that particular attention should be given to women whose situation is in many areas worse than of men. Firstly, older women were more likely to be living alone. In 2017, 58.5% of all men aged 65 years or more living in the EU shared their household with a partner, comparing to only 39.6% for women. So that's something which is very important. And we can also talk about the pension gap in between men and women. In 2019, the women of the EU over 65 received a pension that was on average 30% lower than that of men. So these elements are actually creating a more precarious situation for women, for elderly women, including lack of access to healthcare facilities. So we need to to give more opportunities and accessibility to the labor market for women in order to be sure that we are actually addressing this issue as well. I would like to end by talking a little bit again about digital communication. And unfortunately, the elderly are confronted with more social isolation, also because of the lack of access to digital communication. And for us in Renew, and as liberals, we actually push for technology, and we would like to highlight the importance of technology nowadays. So I would say that the statistics are showing that about, on average, 40% of people aged 65 to 74 have never been using a computer. We need actually to change that, and I will be fighting in Renew as part of the digital transformation to have that on board. One last idea, it's about community projects and the importance of communities of acting there to enrich the social life of the elderly, which we can just wait for the national states to solve the problem of the elderly. We need to engage at community level. And I would say that in the next MFF, the multi-annual financial framework, I would like to see that the EU Solidarity Corps, for instance, will develop further by having a double budget, and many of the projects that they can do can actually be an opportunity for activities that can integrate the elderly more in the life of communities. So we have a elderly component in the EU Solidarity Corps would be quite important. There are many other issues such as lifelong learning and the skills agenda for Europe that should actually have a view on this particular vulnerable group. And I would say that, again, in order to conclude, we need to take care about the rights of this group, not to ignore them, to take them into account. We need actually to invest more in the economy, say in the care industry and in the silver economy to make their lives better. And we need to actually prove more solidarity and enact at a community level and more or less match the initiatives that are already there, so that we can actually have a better life for this particular vulnerable group. We at Renew Europe, we are committed for targeted measures on this particular thing. Today, we are going to launch a position paper on persons with disability, and we are actually quite happy that we can actually come up with liberal solutions that can actually provide care for these groups even better than, I would say, some other political groups in the parliament. But in the end, this is not an ideological issue. The fact that we need to support vulnerable groups, and including the elderly or prioritizing elderly, that's a reality, and we should act immediately upon. Thank you very much.
Thank you very much, MEP Pislato. Maybe if I could pull on your previous life as an economist, because I know this is something you are, and also your fondness sometimes of changing narratives. So to create narratives that are not ideological, as you put yourself. I'm just wondering, do you feel that for want maybe of a better expression, but the economic value of older people, particularly in the informal economy, I'm thinking about, like you were saying, looking after other elderly people within the voluntary sector as well. I see that we know that there's a lot of older elderly people involved in this, and particularly the childcare sector. We can't underestimate the very, very important role that grandparents play in caring for their grandchildren. Is this understated? Is it something that should be brought to the fore and made more public, particularly when we start to talk about the value or the rights of older people within our societies?
Oh, Ronan, you have touched such an important issue here. I've been debating with my colleagues in Romania and here in Europe at Brussels as well. I mean, the elderly are probably one of the, let's say, the most highlighted unpaid category in our society. I mean, the kind of work that they are doing actually in taking care, where we have more enlarged families, especially more, Central and Eastern Europe, I would say, but also in Western Europe as well. So the kind of, the responsibility that they have in terms of taking care of their nephews, but as well as taking care of their partners when we are actually talking about, serious health problems and so on and so forth. it's very, very important. And here we need to acknowledge this particular role, and it does have an economic value. You know, just think in terms of the opportunity cost. I mean, otherwise, if we would have the burden on the public budget to take care of all, you know, the people that are in need and the elderly are substituting for, I mean, that would be an enormous cost. So you are completely right. That's why I suggested that. Okay, first of all, we need to recognize that, and the second thing is that for the elderly that still have some time and energy to invest, I mean, to have them in their society getting engaged and bridging the generational gap, it's amazing. I've seen the way in which you know, the elderly can be energized by children, and the way in which the elderly can actually help children in their development, and that's amazing. And there are so many you know, best practices showing that in care facilities, you know, to mingle, you know, early children with elderly, it's such a good thing. It's providing benefits from a healthcare perspective, and it has an educational impact that is actually quite important. So these examples are there, and civil society is promoting them. We just need to actually acknowledge them better in terms of the public policy and as decision makers. So I mean, I always say that we don't need to reinvent the wheel in terms of, you know, care instruments and so on. We just need to allow the scaling up. I mean, this is exactly as you do an analogy with the market. I mean, the state may try to emulate market decision or entrepreneurial decision, but it's not actually able to do that because it doesn't have the entrepreneurial spirit that you can have at a personal level. So in a similar way, the public policy need to rely on the results and the instruments that have proven successful at grassroots level in, you know, so many communities, and expand them. We don't need to think about the framework here and, you know, believe that we are so smart and we know everything here in Brussels or at the national state level. So indeed, I would say that the solution would be community level, would be about involvement of the elderly, and it's about scaling them up. So, and thank you so much. And that's a very good highlight for our viewers.
Thank you very much, MEP. Now I'm going to move on to our next speaker, Madame Anne-Marie Netz, who is the President of Honor of Liberal International. The floor is yours, Madame Netz.
Thank you very much, Ronan, and hello to my other colleagues, panelists, and hello to everybody. Good morning. I largely agree with many of the suggestions that Dragan has made in his intervention, but I believe that before we jump to speak about remedies and solutions, we should ponder a little bit longer what has actually been going on in the last few months in terms of enlarging the generational gap. And so I would like to make a few comments about that. And I have thought that it is absolutely amazing that as soon as it became clear from the situation in North Italy that elderly people and persons with underlying conditions were particularly vulnerable and dying in alarming numbers, extremely drastic measures have been taken all over Europe and large parts of the world. And actually what has happened is that freedom of movement has almost completely been abolished for the time being, which is extremely amazing and far-reaching. And quite soon, suggestions were made by politicians and so-called experts and opinion makers to literally lock up all people over 60 or over 65 until there is a vaccine. Nobody knows exactly when that will happen. And to do that in order to enable younger and fitter people to keep the economy going. Now, no government has taken such extremely discriminatory measures, but this has made it painfully clear that the situation in many care homes has been extremely bleak, with residents dying in large numbers, staff often insufficiently skilled and trained in taking care of very ill people and running the risk, the staff, I mean, of getting infected themselves. And in several countries, including my own, Belgium, it has happened that elderly care home residents have not been admitted to hospitals, either because they were deemed to be too frail or to free up intensive care beds and to not to put an extra burden on hospital staff and hospital infrastructure. And this means that even if blatantly discriminatory measures against or discriminatory treatment of the elderly has not been introduced, our elderly citizens have often not been treated with maximum efficiency. And I want just to tell you that a few weeks ago, a Belgian economist who is about 40 years old and who works at Oxford University has even suggested that the elderly should pay an extra amount of taxes to compensate for the sacrifices made by the younger generation, sacrifices in order to protect the elderly people. The reactions were such that he has quickly retracted and said, as we could expect, that he had been misunderstood. But nevertheless, this sorry state of affairs points to a number of underlying assumptions, and they are all the more disturbing because they are tacit. One is that society shouldn't spend too much money on elderly people because they only have a limited number of years left to live anyway. A second of these tacit assumptions is that at a certain age, one seems to lose the right to get optimal care. And a third of those tacit assumptions is that optimum care, or optimal care rather, is accordingly something that only younger citizens are entitled to. And this, of course, those tacit assumptions are undermining solidarity. And when there's no solidarity, or when solidarity between the generations is becoming fragile, that means that the fabric of society is ripped apart. And that means that it's going to be all the more difficult to rebuild our communities. So I'm afraid that in any case, we will need to think harder about all of these assumptions. Bring them out into the open, discuss them openly, and so that we can think about them and that we can embrace the suggestions made by Dragon, even in a more positive mind, and in order to see to it that such assumptions don't prevail and don't become the mainstream attitudes in our societies. Thank you.
Thank you, Anami, and thank you, I guess, excuse me, for painting the realistic, or the realism of the situation, how the current pandemic has impacted on the elderly. If I may ask a question, and again, it kind of comes back to this idea of the narrative, the prevailing narrative that seems to be going on in society at the moment, particularly around the elderly people. And you did mention the kind of implicit assumptions that are being made by people who, let's be honest, should know better regarding elderly people. Is there anything that we can do to actively confront this implicit narrative and actually influence it, how should I say, for the positive around the value of elderly people to our society?
Well, that's a very difficult question, of course. what we need to do is to highlight the fact that all generations contribute to society, and that all generations contribute to the well-being of our societies. Dragan has given the example of the voluntary work performed by elderly citizens, but there's also, well, it should be a matter of fundamental basic humanity, that every human being, whatever his or her age, is entitled to the best possible conditions of life and care, and that care and security should not be made dependent on someone's age. And I'm afraid that it will be extremely difficult, and I'm not even sure that this is the good solution, to go back to ancient times when elderly people were revered by the rest of society and the ancestors. I don't think we can go back to that, but we should be actively fighting the discrimination and the age apartheid, which is too often prevailing in our societies.
Thank you very much, Madam Metz. Perhaps now I may turn to Madam Anne-Sophie Parent, who's the General Secretary, of Age Platform Europe. The floor is yours, Madam Parent.
Thank you, Ronan, and thanks for inviting me to join this discussion, because as you can guess, this has been a very crucial issue that have kept Age Platform Europe and all our members very active over the last few months. I would say the crisis has revealed issues and violations of rights that have existed for quite a while. The more our population is aging, the more ageist it becomes, actually. We tend in modern society to reject older persons or just to ignore them more and more. And ageism is everywhere. It's even structural in the way our societies are organized and social protection is organized. You have age limits in some countries to access some treatments, but also the way older persons are viewed more generally in the media, but by everyone. Nobody likes the idea of getting old. Nobody would tell you their age when they reach a certain age. And this is
We seem to have lost you, Anne-Sophie. We don't, I believe you're on mute.
Do you hear me now?
I do,
Yes.
very well, thank you.
Yes, okay, sorry, I don't know, it disappeared. The connection is really not ideal. What I wanted to say is that from the beginning, we have the media and policymakers have made the wrong assumptions that the lockdown measures were introduced to save the life of the most vulnerable. This has not been the purpose of lockdown measures. The lockdown measures were introduced to enable hospitals' emergency care services to recover their capacity to cope with the numbers of cases. But if you look at the number of persons who unfortunately lost their life to COVID, about half of them, and in some countries even more than half of them, are older persons who were never brought to hospitals. So it was not to save those lives that the lockdown measures were introduced. It was really to enable the health system to cope with the pandemic, and there are EU international regulations that enable public authorities to take such measures and to withdraw our liberty and freedom of movement when such an event happens. But the ultimate goal of the lockdown measures have been to save the economic fabric. And nobody has ever understood that except the young and the old who decided to work together as we do all the time. The European Youth Forum and Age Platform Europe decided to send a call when the member states were introducing measures to progressively lift those confinement measures. And we called on the policymakers to understand what is really at stake here. We are facing two major challenges for the moment. One, the most urgent one, is the crisis, the COVID crisis, which has taken even precedence over climate change. Both crises are totally linked to globalization and need to be addressed together in a coherent way, because we need younger people to go back to work, of course, but for that you need the older persons to be active as well and to play their role, because older persons are not only informal carers and volunteers, they are also consumers. A large number and large sectors depend on older people's consumption. They are also investors, and older persons are more than happy to invest, for example, in green products, making sure that the economy will reform itself to enable us all, the existing generations, but the future generations, to have a decent life. And we produced a press release, and we made some recommendations which I would like to raise here. We really urge the Commission to launch the reflection process that was planned before in the Commission's program on demographic change and aging. What do we need to reform? Are our social protection systems adequate to today's challenges? And those challenges have to be framed in the perspective of climate change as well. We need also a very quick action on the implementation of the European Pillar of Social Rights, in particular Principle 18, because we have lost lives of older persons who were locked in a situation. It was not those people who brought the COVID to our countries, but we never blamed the younger ones for doing that. These are just things that happen. But they were unfortunately the most vulnerable toward the virus. And don't forget about the older persons who have died at home, because those who receive long-term care at home, all of a sudden they were not receiving any support anymore. They were not in a better position. We need to review completely the way we organize our whole healthcare system, but also all the social care and all the contribution that everyone makes. And for that, we are very pleased that there is today a big discussion on the future budget and what kind of support the EU can provide to those who have been hurt more badly than others. We hope that there will be a strong decision and that the EU will show that it has teeth and that it can help its member states and it can help all citizens, whatever their age, to have the life they deserve. Human beings have human rights until the end of their lives. The United Nations Secretary General made a statement on the rights of older persons, and 146 member states have signed the statement and committed to do their utmost to better protect the rights of older persons, because all of a sudden, everybody understands that there is a form of racism, which is called ageism, which is the last form of discrimination, which is widely accepted, is even structurally pervading our societies and needs to be addressed. The Council of Europe has now also taken action. So this crisis has highlighted weaknesses. Young people are suffering a lot. Why? It is those who do not have adequate social protection when they lose their job. And we are fighting to get them better protection. We have been fighting with them to get them better pensions. We should continue to work all together, all generations. And even the EU should lead a global discussions on how to mobilize all generations to create a society that is good for everyone, regardless of their age, and is good for the planet. And the economy must support this vision of a society which is inclusive and good to the planet. Thank you.
Thank you very, very much for your intervention, but also highlighting, I think, something that has been missing somewhat, but was definitely mentioned in the previous interventions. And this is something concrete when we talk about solidarity, of course, between the ages, between what one would categorize as being young and what one might categorize as being old as well, which I think is incredibly important and pulls on this idea of the social fabric, I think, that Annie May mentioned in her intervention. And Sophie, if I may ask, because I know Age Platform Europe do have members at the national and the local level as well. And very, very often in this big melee and this big debate we're having at the European level, sometimes the realism or the reality of what's happening at the local level is sometimes forgotten about. But this is where, when we talk about the tangible problems and practical, and where at times are very, very practical solutions, this is where we find the best examples, I find. If I may ask, as we move into the future, and you talked a lot about the need to look at better social protection, the need to look at better provision of services, better protection of older people, also better protection of the rights of older people. As national authorities start to plan for the future, to start to plan for a post-COVID world where COVID is still obviously a potential threat, what are the key aspects that they need to include within that planning? And in fact, how would they or should they even make sure that older people are implicit and involved in the development of those plans?
Well, the first thing they should do is involve some representative organizations that represent the different groups who are affected by the crisis, because they have, I can understand that in the beginning, the crisis was so urgent, they just had to move forward, but they tended to listen to so-called experts. And depending on the, and Anami mentioned a case, but there was another philosopher and well-known experts who was speaking last Sunday, and being himself age 70, considered that he was privileged and that he didn't see why there should be money spent on saving his life rather than on spending on the economy. Those are two things that have nothing to do with each other. You can just let everyone, every older person's age 65 plus die for the moment. This will only reduce the support they bring to the economy. It's going to be disastrous. So that's not the answer to the question. We should not oppose generations. We are all in the same boat and we need everyone to be able to play their role. So the policymakers should also consult more with the groups, but not only older persons, also the younger ones. They do have tremendous challenges, but those challenges at the end are the same, because we have also ageism toward the young. The working conditions of the young have been deteriorating. The working conditions of the middle class and the lower earners have been deteriorating. It's social inequalities. And then we have to look at ourselves and just analyze, are we able to continue to function, be mobile, do whatever we want, buy things and then throw them in the garbage the way we have done so far? Aren't we all abusing the planet and abusing ourselves? Because when we abuse the planet, we are abusing ourselves as humankind. And those need really very serious discussions with people who will have some kind of vision of what needs to be done, rather than opposing groups. How can we get everybody to be really mobilized? Just before this crisis started, you had a wonderful mobilization of the young people together with the older persons. Grandparents for Climate, for example, they were really supporting the young people, telling them, yes, we need to do something to make sure you do have a future. Because as grandparents, we care more about what will happen to our grandchildren and their friends than we care for ourselves.
Thank you very much.
But we need to be heard.
We do indeed.
We're not locked down in our home forever.
May I stress there are lots of people who are posting questions who also want to hear your opinions on a number of topics that they've identified as being quite important. So maybe with that, we'll move to the second part of this online discussion, where we like those questions, like I just said, and we can discuss. The first question comes from Gordon, and he asks, the potential implications of the virus for older people in poorer parts of the world are horrendous. These consequences will be worse if the developed world responds by retreating behind national borders, economically and, of course, politically. Should the rest of the world accept any responsibility for responding to the needs of older people in these places? Who would like to answer what is a very, very difficult question, but at the same time?
Well, if you allow me, as we have said that generations should work together, and that the fate of one generation has effects on all the other ones, and vice versa. The same, of course, applies to the world population as a whole. And if situation deteriorates very badly in Africa, for instance, but may I point to the fact that the situation in Latin America is absolutely dramatic. If you look at the numbers in Argentina, Brazil, and other countries, we need worldwide solidarity. And even if the situation is very difficult for everyone, I would say all the more reasons to work together. And all the more reasons to try to avoid all extreme, well, all forms of protectionism, or for instance, the rush for vaccines, where we have had ongoing discussions. Should the vaccine be reserved to for the population of the country where the first ones have developed, or should they? Must we make them available to the world population? Yes, we must. And so the answer is yes, even in these very difficult times, we should contribute to alleviate the situation worldwide and for all generations, including the elderly.
May I add something on what Annemie just said?
Yes, please.
Yeah. It is certainly essential that if there is a vaccine developed that is really efficient and a treatment, it should be considered as a common good that is accessible to everyone. Of course, we have to pay the cost for producing it, but not the cost for valuing the intellectual property that will be behind, because the size of the pandemic and its global dissemination calls for something that will be available to all. For a very selfish reason, we have understood from the COVID crisis that we cannot afford for ourselves to have other parts of the world being devastated by other pandemics. If we want to protect ourselves, they have to be in good health as well. They have to have access to good health and social care just like us, and good social protection. That's the only way we can all live together in peace and be sure that we will be protected. So if we don't do it for human rights reasons, which is the reason why I would do it, because there is a fundamental right to health, we should do it for selfish reasons. That means to make sure everybody is protected, including ourselves.
Thank you, Anne-Sophie. I have another question from Victor, who asks, who can or should be held responsible for the preventable deaths that took place in care homes throughout Europe? And how can we avoid this scenario repeating itself in the future?
Well, the most important is to put some hard thinking to what has happened and see what should we do to avoid a repetition. That's even more important than pointing accusing fingers at whoever is responsible. I would say, broadly speaking, that in as much as in all of our countries, we have allowed the situation in care homes to be bleak, and we have known the situation to be bleak. We are all responsible for what has happened. So that's one element. And what we should do is provide the care homes with sufficient well-skilled staff, pay the staff better, because the people who work in care homes are terribly underpaid. And protocols should be developed to make sure that all care homes have sufficient stock of protection material. And probably we should be more demanding of the skills and the competence of the heads of care homes, because in my experience, what I've seen around me is that very much depends on the human quality and the efficiency and the dedication of whoever is managing the care home. And so a lot of attention should be paid to that. At the same time, we must avoid to excuse me for the bad word I'm going to use, we must avoid over-medicalization of care homes. They should not be kind of substitute hospitals. So there's a new model that should be developed with more foresight, with probably also less intrusive regulations, because I suppose that in many places the situation is like it is in my country. That is that care homes are subjected to very detailed regulations. They have very little autonomy, and if you don't give people autonomy, they lose the ability to take autonomous decisions whenever the situation requires that. So there is a new balance that must be found.
You may be aware that the European Center for Disease Control has issued guidelines for long-term care residential facilities and nursing homes, because you do have two different types of institutions accommodating persons who need long-term care, those who do have medical needs, very heavy medical needs, and do not want to spend the rest of their life in a hospital. So that has to be accommodated, and this group is going to grow in numbers very fast because we have an aging population. The group of 80-pluser is going to increase very rapidly, and the number of persons with severe dementia is going to increase severely. And it is those people who have suffered most casualties because they depend entirely on people who have to look after them 24 hours a day. So we need to find solutions to make sure that the carers are trained about how to deal with a pandemic. All they knew more or less, not even all of them, because when staff is scarce and often not qualified, they don't even know the good way of dealing to avoid spreading the virus inside the care homes. You cannot blame them. I would never blame them. They did what they could, but they were left on their own. Some have been wonderful. Some have had some knowledge of nursing and were able to introduce some hygiene measures, even though this was not recommended, because those second line structures, as we say, were forgotten in the beginning. They were not given instructions, they were not helped. Everybody was in the urgency of dealing with emergency care in hospital. So lessons have to be drawn, but some did better, and we have to look why they did better. It is those who have very specialized institutions for persons with very severe dependency needs. The staff is trained in the healthcare sector. They are nurses, so they know better how to deal with that. But even that was not ideal because there was, let's say, openly, everybody said it, a lack of personal protective equipment. The EU as such, the countries were not ready. Although the pandemic had been hanging around and there were alerts months and months before, we faced a huge problem there, which has developed into all the casualties we have seen. So now we are prepared. We should know best for the next time, and we know there might be a second wave or another type of pandemic. So let's keep stock, or let's organize things so that we have what we need in the EU so that it can be mobilized immediately when needed, rather than have countries compete with each other, even within the EU, to have access to essential goods, which were things that should have been available easily before. But we have seen countries fighting with each other, even stealing orders from each other. And that's something that we have to reorganize. But of course, when there is such an urgency, you try to save yourself, save your close ones, and that's a natural reaction. But there is really a lot to be reviewed completely in the long-term care sector. And actually the EU had started a process of improving the long-term care provision through the implementation of Principle 18 of the Pillar of Social Rights. There is work going on. This work is even more urgent, but the qualification of staff, like Annemie says, is essential, giving them good working conditions, but also developing backup protocols when staff is ill. You cannot just take someone who has lost his job due to the crisis and ask them to look after sick people, to replace the medical staff who has disappeared. They need training. They need to, otherwise it's going to be again a catastrophe if we don't draw the lessons. And for that, we hope that the EU budget and the special measures that are going to be announced today are going to take that on board and not just stop at emergency care, but really look at the whole spectrum of what do you need to keep people healthy. And that includes measures to support people who are locked in. Locked in your home is okay if someone takes care of feeding you or bringing you food, which has been a real problem for many older persons who were considered to be too frail, stayed at home, used to have someone bringing food to them, and all this disappeared, was completely dismantled overnight. So let's be prepared. The best way to avoid a problem is to be prepared.
Thank you very much. And with that, perhaps I'm just going to ask one final question, because it was a point that was touched on by MEP Pislaru earlier, who unfortunately, I should inform our listeners, has had to leave this session, but we thank him for his intervention earlier. MEP Pislaru mentioned the issues in or around the use of social media or new online medias. And this question coming from Philip asks, how do you see a potential Corona app? Are they discriminating against the elderly who don't necessarily have the newest smartphones, thus compatibility problems? Such an app might not also be easy to use. Very, very quickly.
Make the app accessible to persons who do not necessarily are very digitally skilled. You just ask someone to organize it in a way that is easy to understand and on a cheap support, because smartphones are very expensive and many older persons just cannot use them because they are not very easy to use, but they are just also too expensive. It is very easy to make an app that is accessible to everyone, and you then even give it to those who cannot afford to have it, because that would help a lot.
I completely agree. I completely agree.
I think maybe with that, because I'm also looking at the time, we may end this discussion. And thank you very much for your input. Voila, I have voila, not such a easy task in terms of trying to bring together two or three concluding points. One of the common threads, most definitely I would have seen throughout the course of our conversation, has been discussions or points made around the need to, on the one hand, improve the long-term care sector, but also to make it more, to make accessibility to quality services in which staff are adequately trained to work with older people, but also know and respect the rights of older people. This is something that we need to ensure. The other key kind of point that came across to me during your interventions was the idea of generations working together. So it's changing, the narrative for the positive, or in fact highlighting something that's been going on for a number of years already. I mean, I think, and Sophie, you mentioned the work between the European Youth Forum and your own platform, or Age platform, which in a way kind of is a perfect example of the cooperation. So the idea of, excuse me, generations working together, not just in Europe, but also globally speaking, because this is a global pandemic. As we know that the issues we are currently facing and trying to address are not specific to one age group or category. So I think this is the other important thing. The last point, and maybe not to be too tweed about it, there is a lot of talk about a vaccine, but perhaps the vaccine that we need now, in fact, is a return to some of those old-fashioned European values: solidarity, compassion, humanistic view of how we see each other and how we work and treat with the most vulnerable within our societies as well. So maybe a vaccine may be far off, but I think these simple steps, these simple considerations, I think is something that everybody can get behind, endorse, and of course, try to implement in their day-to-day life. All that's left for me to say is thank you to our speakers, to Anne-Sophie Parent, to Annemie Netz, and of course to MEP Dragos Pislaru, who had to leave us, and of course to thank the colleagues in the European Liberal Forum who organized this event. I will now hand over to Daniel, and thank you very much.
Thank you as well, Ronan, and thank you very much for the excellent facilitation of this panel here today. I think it was quite important that we talked about that and got a couple of different viewpoints here, and especially talk about viewpoints that are very much neglected in the public discussion that we have at the moment. And one might say, oh, why are liberals now talking about that? Well, liberals are all about freedom, but liberals are also all about responsibility. And living in a society also brings responsibility for others with it. And there is always a lot of talk about equality of opportunity, but equality of opportunity doesn't stop when you go to school. Equality of opportunity should also be equality of opportunity to partake in life also at a later stage and not be isolated, like Annemie said, in the care homes and not having any access to social life, which makes you more vulnerable and more prone to, well, a lot of problems, especially when it comes to mental health, and not to mention physical health. This concludes today's session of Liberties in Lockdown, but that does not conclude the series of Liberties in Lockdown, unfortunately, because the lockdown is still going on, the pandemic is still going on. But fortunately, we already have a topic for next week, and we also have speakers already for next week. Next week, we'll be talking about the future of work and the right to work, which is in jeopardy, has been in jeopardy for a lot of people for quite a long time, where the livelihood of a lot of people have been in question. So tune in next Wednesday, 9:30, to talk about the future of work and the right to work. And once again, thank you, Ronan. Thank you, Annemie. Thank you, Anne-Sophie. And of course, even though he's not here anymore, thank you, Dragos, for this excellent discussion, and see you next week. Goodbye.